Hi, this is Chris Dewey with May River Medicare, and let's cut to the chase. Some unsettling news for folks on certain Medicare supplements with certain carriers, so let's just dive into it. Got a phone call last week. Actually, I got an email first. I looked with dismay when I heard it, but Allstate Health Solutions. Allstate is property and casualty, but about 5 years ago, they dove into the Medicare Supplement business. They bought out a company called National General. They came out with real low rates with the household discount, but their medical loss ratios, because of excess utilization of their plans, have gone up higher than expected. They left the Medicare market because they're losing money. Good news is you're not losing your Allstate coverage. You're not losing your benefits. All three companies that I mentioned are financially stable. They're all A-rated. You don't need to worry about them not paying claims. You can keep your Allstate policy, your Manhattan Life policy. Ace Chubb is another one that's leaving. So let's just focus on Allstate and focus on what happens when my company that I have a Medicare supplement with no longer is in the business. This is effective immediately with Allstate. So for all my Allstate clients and for folks all over the country that have Allstate, relax, take a deep breath. You're not losing your supplement. Existing Allstate clients can keep their supplements with Allstate, but Allstate's not taking on any new clients. They closed their book of business, so no new healthy folks, new to Medicare, or folks that can pass underwriting, they're not allowed into Allstate anymore. They shut it down. The reality is that the best time to change your Medicare supplement is on your policy anniversary date, the effective date of the month that you took the policy out. The worst time to change is during the annual enrollment period for a multitude of reasons, but you can change supplements any darn time you want, provided that you pass underwriting. So, over the last 13 years, when a company like Allstate closes their book of business, the rates can and will get out of control. So yes, you get to keep your Allstate policy, but herein lies the problem. Because Allstate is closing their Medicare supplement business, they're not taking on any more new clients. So those 10,000 folks that turn 65 each and every day, the young, healthy ones, the folks that graduated in high school in 1978, they can't enroll in Allstate. Another group of folks that cannot enroll in Allstate are healthy seniors, 65 to 89. They can pass medical underwriting, answer no to all the health questions. So new people, healthy people from this year to infinity, to infinitum, they cannot help replenish Allstate's risk pool. So it's kind of like being on a sinking ship with an older, sicker pool of people with no healthy shipmates. The healthy ones with less claims, less chronic conditions, they counterbalance the folks with lots of claims from surgeries or skilled care. So with no new people, no healthy people, able to come on board with Allstate, their loss ratio, or how much they get in premiums, how much they take in premiums, minus how much they pay out in claims, it's not going to be good when they're not getting any new premiums and they have older, sicker pool of people. So sadly, there's a lot of Allstate folks out there that are stuck with Allstate because they can't pass underwriting. So because they can't pass underwriting, they're in good hands with Allstate for life. And so the older, sicker pool of folks are stuck on a sinking ship. And you want to bail out before you develop a chronic condition like AFib or spinal stenosis, rheumatoid arthritis, any number of deniable health issues. I mean, even if you take a drug like Eliquis and you just started taking it, a lot of companies are going to deny you. It's on their deniable drug list. So the point is, huge rate increases typically follow a company with a closed book of business. You have more claims over time with no new premiums coming in. So if you're in one of the 33 states that does require answering health questions and underwriting, most of the Southeast, there are 17 states where they offer guaranteed issue rights at least once a year. New York, Connecticut, Massachusetts, you could enroll in a Medicare supplement even if you have cancer, and they don't do underwriting. Your premiums are quadruple what they are in South Carolina. But similar with the birthday states, since Kentucky, California, Idaho, Illinois, Maryland, Oregon, Nevada, Louisiana, I said Kentucky, Virginia, and Utah. These states, right around your birthday, you have like a 30-day, perhaps a 60-day window where you have to have a Medicare supplement in order to do this, but you can leave your Medicare supplement and change to a different company, or you can change to a equal or lesser letter, like a G to a G or N to an N. And there's no underwriting or health questions, but we have seen dramatic rate increases in those birthday states because insurance companies have to eat the high cost of insuring folks with chronic conditions. So moving on, let's just assume you're in the Southeast, South Carolina, North Carolina, Texas. So if you have Allstate or Manhattan Life or Ace Property and Casualty, any one of those three that are no longer going to be taking new clients on, I get out sooner than later. In fact, now's a great time for you to do your due diligence and start doing research. We educate, empower, and enroll. What I want you to do right now, you can go to supplementquote.com, like Medicare Supplement, but it's supplementquote.com, or mayrivermedicare.com. So what supplementquote.com does, or mayrivermedicare.com, on the home page, on the front page, you're going to see a quote engine, a tool. It's going to say, compare all plans. And what I mean by all is every single carrier that offers a Medicare supplement in your county. It's based on your zip code, your date of birth, two most important factors. And then you're just going to type in your gender and whether you smoke tobacco, do tobacco or not. The quote tool needs that little bit of information to generate all quotes in your county, in your area, because that's what it's based on. Okay, guys, first up, let's empower you to do just a little bit of research. And this is easy. You can either go to supplementquote.com, and right here is the actual shop plans and self-enroll tool. Here's a video that explains how to use it. It's pretty self-explanatory, but if you want to watch the video before you do it, that's fine. Here's the Medicare site, same exact quote engine, videos on the left that explain it. So let's do it. We're going to click. There's 4 choices. The one you're going to choose is I have a supplemental plan, but want to find a lower rate, or get out of one that's going to have high rates. So once we click on that, it's going to take you right to the preliminary application. Now, there's a video on Medicare Basics. You can click here. It pops up. So again, this is the preliminary application. You're going to have to answer this again. I have a supplemental plan, but I want to find a lower rate. That's the one. You're not on an Advantage plan considering a supplement. You're not new to Medicare. You're on a supplement plan. You want to find a lower rate. So we click that, and then this pops up. A video that explains your 2 main options, Plan G and Plan N. Here's a video right here. You can click on it. Really, it takes a deep dive into the difference, which honestly, there isn't much of a difference. Plan G's got a $257 deductible. The Plan N has the same $257 annual Part B deductible, but you know what? You got a little $0 to $20 copay, up to $20, never more than $20. Could be 0, could be 10, could be 13. And you have a $50 ER visit. That's basically those are the only differences, other than something called excess charges, which is no big deal, but you can watch the video. So you're going to click continue, and it's going to go here. And it's going to say choose your plan. So are you going to go with the Plan G? Now keep in mind, the Plan G must take chronically ill sick people that use their guaranteed issue rate. And there's certain situations, if your Advantage plan exits the service area, or you move from Ohio to Hilton Head and your Advantage plan Ohio is not offered in Hilton Head, you can get a Medicare supplement with no health questions or underwriting asked. Not just any Medicare supplement, the Plan G. The Plan G is what the F used to be. The F used to have to take chronically ill sick people that lost retiree coverage. Their Advantage plan didn't renew, so they get, even if they have cancer or AIDS, they can still get the Plan G. The Plan N, they can't get that. So think about that with rate increases. Plan G must absorb the ridiculous cost of insuring people without having to ask health questions. So I'm going to go with Plan N, and it's going to take us to get your quote. So like I said earlier, you got to have your zip code. They need to know how old you are, and they need to know if you're smoking tobacco or not, and what your gender is. Those are the determinants in how they look at the rates. So we click. You do that, when you click that and hit next, it's going to have a video. Good news, we found some, so it's going to say, good news, watch this video for 3 things to consider. There's only one thing to consider. You don't need to watch the video, but it's helpful. Medicare supplements are standardized by Medicare, meaning the same. Different insurance companies charge vastly different premiums for the same exact benefits and coverage for the same policies. So when you're comparing plans, you want to compare a G to a G. Now, so you click continue, and it's going to go boom. So Humana is the lowest in Beaufort and Jasper County at 77. The highest one is United Healthcare at 476, but that's a standard rating. And you just can shop through, and you got lots of Allstates because of their household discounts, Fitbit, what have you. ARP, 88. You can go to Blue Cross around 123. Mutual of Omaha's right around 123, and Mutual of Omaha's 123. Blue Cross about 126. You can look at it yourself. Cigna 95, closed book of business. You don't want that, so we're ready to go here. So I'm going to go, if this was me, I'd take a little bit of a higher rate. I'd go with Wellaby. So you're going to see if you qualify. Once you hit that, boom, great choice. It's going to talk to you about what the next steps are. You hit continue. Boom. All that's left are the health questions. 3 little things to do. Answer some health questions. Give us some basic information. Give us your med list and your primary care doctor, just in case you might be on 3 blood pressure pills and maybe metformin. The company that you chose is not set in stone. We can always pivot to a company that's going to give you a better rate using our underwriting software, so don't worry about it. Pick a good company with a good rate. But bottom line is, at the very end of this process, in a minute, you're going to click a calendar. You're going to pick a day and time for me to call you to review the application. We're going to hold your hand through the whole process, okay? So what we're going to do is we're going to click continue, and then they're going to ask for its full underwriting. What's your Part A and Part B date? We need that. Name, address, phone number, that kind of stuff. You need that for your application. You need your Medicare card, your A and B again. It's redundant. We ask it twice, but that's all right. Do you want us to send you your guide to people, your Medicare guide outlining coverage and notice of information practices? Do you want it emailed or do you want it mailed? We're going to click, I want it emailed. So we're going to click next. And you're not on Medicaid, you have a supplement, and you do intend to replace it. So it's very simple. Doctor, no. James Bond, all right. He's in Bluffton. And I answer no to these questions. I'm not hospitalized. I don't have surgery planned. I don't have physical therapy. I've been hospitalized 2 or more times in the last year. I don't have diabetes and take insulin, or I don't take a bunch of blood pressures and have retinopathy. And you just go through to the best of your knowledge, all right? Just click on what you may have. So I only have spinal stenosis. Some companies will reject you. I know which companies will accept you. So we're going to click next. It takes 2 seconds. All right. You can put your meds here. You can add a medication. I put Ozempic. Not really on Ozempic. We submit it. Boom. This simple. I go over what the next steps are. You've submitted an application with your info. Didn't ask for your payment, your routing number, account, or credit card. Didn't ask for your social security number. But when I call you and I review your meds, your doctors, and everything, what's going to happen is you are going to, first of all, before I call you, you're going to set up a day and a time. So you can set it up for May 30th at 9 o'clock. You're going to hit next. You're going to put your information in, and boom, I'm going to send you reminders. I'm going to call you. We're going to make sure your application's in good order. We're going to review your meds and doctors and make sure that the company that we chose is the best fit for you. And we're transparent. We want you to be able to be educated and empower yourself to see all the rates from lowest to highest. So we show them all. We're licensed with about 85% of those companies. The 15% we're not licensed with is for good reason.